This patient was referred to me for endodontic treatment of tooth number 31. According to the patient, she had an old crown that she cracked and she needed a new crown. Her dentist about 2 months ago cut the old crown off, made her a new crown. That's the new crown. And patient says ever since then, about 2 months, she's been in a lot of pain, constant pain. She has to take pain medication for it. Pain, toothache wakes her up in the middle of the night. Tooth hurts to biting, to cold. Patient says when she eats or drinks something cold, tooth hurts a lot and then it radiates and throbs for hours afterwards. She was seen by her dentist. The bite was adjusted, occlusion adjusted a couple of times with no help, and finally patient was referred to me for endodontic treatment of the tooth. Tooth was tendered to percussion today, palpation within normal limits, probings 2 to 3 millimeters all around. That was a CEREC crown, really nice crown as well. So we discuss options with the patient. This is irreversible pulpitis, of course, with acute apical periodontitis. We discussed options with the patient. Patient wanted to try to save the tooth, of course. So, and that's what we did today. We squeezed her in as an emergency because she was hurting. This was a hot tooth. Hot teeth are not usually easy to anesthetize, especially a mandibular hot tooth. And on top of that, this patient was anxious as well. So a couple of IA injections, cold tested the tooth. That didn't work. Then went ahead and gave her a couple of PDLs around the tooth and cold tested the tooth again. Nothing. She had profound local anesthesia. And we were able to go through the CEREC crown and do this root canal for her on an emergency patient on a hot tooth. And take a look. It's a post-op. As you can see, everything went beautifully. Take a look here. Look at the anastomosis between the mesial canals there. One large diameter. So before you say anything about this is just, I do warm vertical obturation. You put that's my master gutta-percha, and then when I cut it and condense it, and then when I put the gutta-percha gun in there, sometimes you get these little tiny gaps. That's normal. That's within normal limits. There are no issues with that. Gaps don't cause endodontic failure. Bacteria causes endodontic failure. All right, so you can see everything went beautifully. Look at that anastomosis between the mesial canals. But everything went great, as you can see. Went through the new crown, no issues, no problems in the crack, or it didn't crack or anything. So I leave it up to the dentist to decide if he wants to make the patient a new crown or just wants to restore my endo access permanently with composite or something like that.